years ago, the company General Electric launched Healthy Imagination, a strategy with a pledge to deliver better care to more people. I'm here now with Mike Barber, who is Vice President of Healthy Imagination at General Electric. Mike, great to see you.
Good to be here.
Well, it certainly is easy to say, deliver better care to more people, but maybe not so easy to implement?
That's right. And one of the things for us as we look at healthcare around the world, it's something that healthcare systems and how people interact with those systems is actually different in different places. So healthcare is local. So we feel we have to really understand what happens on the ground, how a patient progresses through the care continuum, and are there then inefficiencies that we can focus on with new products, new technologies, new services to improve care, lower costs, and provide better access to care for more people around the world. But you have to really understand how it happens locally. And then with GE, we feel we have the global scale to be able to have products and platforms that we can leverage from one market to another.
Okay, so you're doing the materials, you're putting out the information, really getting education out there to help people understand what needs to be done to get more healthy, right? Is that one of the first steps?
That's part of it. We have, in a healthcare system, there's many different stakeholders. There's the providers, the hospitals and the administration of a hospital. There are the doctors, who are the primary focal point in many situations. There's the patient. You really want to put the patient at the center and understand what's going on with the patient. And then there's the payers. And so really, all four stakeholders we're trying to reach out to in new and different ways. We have businesses which work with hospitals to make sure they can be more efficient. They can track access. They look at standards of care in terms of protocols that they follow with patients, consumer education with patients, and how you can motivate and educate consumers, because you are in control of your health, and in many instances you are what you eat. If you don't smoke, those kinds of things are important for consumers to understand. Doctors, making sure they understand what's the latest available in terms of the standard of care, what's the appropriate use of technology that should be there, and then working with payers, because at the end of the day they pay the bill, and what that means to ensure that for a continuum of care for a particular procedure can be done most cost effectively.
And you mentioned also you're not just looking at GE employees, because this might have an effect on people around those core employees. Is that right?
Oh, absolutely. This is actually, we're in the healthcare business, so we look at this as a business proposition. We work in hundreds of countries around the world, and we sell different types of medical equipment, IT products, life sciences products. But then also, when you think about Healthy Imagination, there is an employee part as well. GE is a self-insured employer, so we have about 600,000 covered lives that are part of that family. And so there's things we're doing with our own employees and with hospitals in different cities around the country where our employees live and work. But Healthy Imagination is first and foremost how we want to think about the business. Okay.
Do you have a way of measuring the outcome of all of this investment that you're putting into the education and from there on?
Yes,
too?
We do. We have a third-party organization by the name of Oxford Analytica. They're out of the Oxford University in the UK, and they're a consortium of policy people, researchers, analysts, health economists around the world that are versed in the healthcare space. And so if we are coming out with a new product or a new service that we believe will improve the cost of a procedure by 15% or more, we have to supply external third-party data from a hospital, from a payer, that Oxford will look at. They'll compare it to what's the standards that they see by looking through published reports in whatever market that we're intending this for, and they will say yay or nay if in fact this product meets that. So we have a validation process by a third party to validate the work that we're doing.
And is there a time that we should keep in mind, some type of deadline, if you will, to have results in? And
well, the initiative is ongoing from 2009. As you said, it kicked off through 2015, so that's our first phase that we're looking at in terms of improving cost, quality, and access. And between that time, we're going to invest about $3 billion in product development, and we're targeting to have over 100 new products come out specifically targeted where we can have that type of validation for it.
And the number of people that will be touched by the program by 2015?
When you talk about an access improvement of 15% a year, that's touching with new life-saving technologies about 100 million additional people every year.
Wow.
So that's the target we've given there.
That's a lot of people. What do you think GE might want to do at 2015? Any discussion about how to take Healthy Imagination to the next step after that?
Well, I think clearly the things won't be solved at that point. Healthcare is a very complex, as you said, situation. There will be new advances, new technologies, new capabilities in terms of genomics and proteomics that might be available then that aren't available now. So I'm sure we'll have another phase of this to continue to look forward because healthcare is, because of demographics, because of what's happening around the world, it's not something that's going to end and we have nirvana by 2015. We know that. We'll continue to have to partner and work as we move forward.
All right. Mike Barber, thanks for stopping by.
Thank you.
Appreciate it. I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.